today. So thank you for understanding that and helping our meetings be as accessible as possible for all people. So my name is Erin Barger. It's a pleasure to spend an hour with you today. Again, this is the meeting of Abundance Athens, which is the agriculture action group for Envision Athens. For those of you who are new to this space, Envision Athens is the 20-year community and economic development plan organized across 14 domains. So agriculture is one of 14 various
Erin? Might have lost Erin there. Well, I'll pick up where she was leaving off while she gets reconnected. She might be getting reconnected now. Abundance Athens connects to our agriculture domain, and this group, of course, is working on establishing a fresh food access on the east side, and we've also pivoted recently. Yes, Erin was just kicked from the meeting, so she'll probably rejoin in just a second. But this group has recently repivoted towards a lot of other food access needs throughout the pandemic and become a really collaborative group with a lot of stakeholder involvement. So I believe that the agenda was shared in the chat by Erin, and before she left, I'm gonna go ahead and reshare that agenda in the chat.
Can you guys hear me?
Hey, Erin, welcome back.
Okay, that was the fastest boot off and return that I've ever experienced. So I'm not really sure what happened there. Thanks for bearing with me. John, thanks for your for having my back there.
Yeah,
that is a bit of history of this group. If rather than take our limited time today to introduce everyone at the table, I would love to just welcome anyone who is new to this conversation to introduce yourself if you're comfortable doing so. So Dr. Moore, Jamie, let's start with you.
Hi, I'm Jamie Dysmore. I'm the chair of the Family Connection Communities and Schools Early Care and Learning Strategic Action Team. And we've got a grant that we're applying for addressing food insecurity. That's why I'm here. I'm also the affiliate director of the Georgia Association for the Education of Young Children, which is the professional development organization for early childhood educators in Georgia.
Great. Okay, welcome, Jamie, Dr. Moore. Whom else? Catherine?
Hi, yeah, I'm Catherine. I'm the new community health worker at St. Mary's. It's kind of a new program that we have going. So basically my role is going to be to connect patients that are needing different social needs like housing and food to the accurate resources for hopefully long-term health and stability and just making sure they actually get help from those places.
Great, thank you, and welcome. Congrats on your new position. And then Suzanne, welcome back. I think it's been a minute since you've joined us, so would love for you to introduce yourself.
Yeah, hi everyone. I'm Suzanne Gardner. I'm the Community Outreach Manager at Georgia Organics, and I live here local to Athens. It's been a while since I've been able to attend, but definitely follow along in the meeting notes that are shared out and appreciate those. I think what I can offer is some of our resources in the form of online education opportunities and mini grants that we might have coming up in future quarters in 2021.
Great. Okay, thank you. Is there anyone else who's relatively new to the group that would like to introduce yourself before we dive into the agenda? All right. So in terms of response to COVID and ensuring that food needs of our neighbors were met, I want to definitely thank and acknowledge the heavy lifting done by all of the neighborhood leaders on this call. I see Patrick and I think Samaya is joining, and Terrace for her leadership there. And then definitely the work of folks like Andy and Josh, the Office of Service Learning, and of course the Council on Aging, Eve and Leslie. So thank you guys so much for all the work that you did to help us understand the needs that we have and then work to meet those needs. So Eve, I'm gonna turn it over to you, and I believe Meg at some point, to share what you learned from the evaluation of Athens Eats Together. Look forward to that. Thank you.
Thanks, Erin. And hopefully, am I buzzing? Is my mic? Okay. Yay, good. Well, thanks for asking us to do this presentation about Athens Eats Together. Originally, we were thinking that Athens Eats was going to end at the end of its contract in January. So the discussion about us presenting today was to look at the full evaluation data and some of the service data we have. As I hope everyone knows, Athens Eats was extended through the end of April. So we will have further data to look at and evaluate when we're done with the project. But we've served so many numbers that I think it's safe to go ahead and talk about some of the things we've learned. And I also want to say, so Athens Eats Together is a collaborative effort, and it is successful because of that collaboration. And our partners, of course, we were funded through the Athens-Clarke County government, and Stephen Bailey is on the call. Stephen, Crystal, and Haley are absolutely critical in the design, implementation, and evaluation of this program. So the Food Bank of Northeast Georgia, Epstein Events, the Farmers Market, and Family Connection Communities and Schools. Aaron already mentioned the neighborhood leaders who were a huge asset. And I think every partner in this project has a story, and they would tell that story the same, but probably a little differently based on their experiences. So really, this is the experience of ACCA in the work that we've done. So just a real brief history of Athens Eats, because I think it's important when we evaluate the success of the program to look at what was the purpose and the intent. So in March, in response to COVID-19, ACCA pivoted our entire operations into 3 focus areas. Those are social connections for older adults, safety checks for older adults, and emergency food relief for older adults. So basically, we moved our organization to the Meals on Wheels model. We, within 3 weeks of the COVID and all the shutdown, had already increased our meal capacity to 200%. As of earlier this month, we have gone a 4,000% increase. We were providing meals to 180 people prior to COVID. We just reached 9,100 as of last month. So in May of 2020, Stephen gave me a call and approached ACCA to ask if we could assist with providing countywide food relief. And that's based on our ability to expand our capacity and our ability. We had the Meals on Wheels infrastructure, so we were able to deliver the meals as well. The official contract for Athens Eats Together is September through the end of January 2021. As all things happen in the world of contracts, nobody's fault whatsoever. We received the contract at the end of September. We received the first payment in mid-November. So it wasn't until October that we fully ramped up and got Athens Eats going. The goal of Athens Eats was to provide 10,000, is to at this point, 10,000 food relief to 10,000 Athens-Clarke County residents. So I think it's really important that, and to recognize the efforts of Stephen, Haley, Crystal, our leadership staff at ACCA, because every portion of Athens Eats, it was designed with intent. If you saw the timeline, we started talking about this in May and launched in September. There was a lot of conversations about our number one and only purpose was to provide food relief to Athens-Clarke County residents in response to COVID-19. The secondary were conversations where how do we provide the most relief to the most people, the right people, and how do we do it with dignity and respect? And so a lot of the conversations that we had in the design of the program really tailored around those things. So we created an easy, accessible intake process. So anyone in Athens-Clarke County experiencing food need, both English and Spanish speakers can call a centralized phone line. They can go to our ACCA website, or they can enroll at one of our distributions. And although there was demographic information that was required that we collect as far as income information, we try to make that enrollment process as easy and as efficient as it could possibly be. We asked enrollees at the time, what is the best way to get food? Some people could say we can pick up. So then we told them when the next distribution was. And some people said we need to have the meals delivered to us. We had a guarantee that you called, you would receive food within 24 hours. Most of the time, people could receive food within 2 hours. And we had weekly distributions throughout the county. And this is something that hopefully Joshua will have a couple minutes to talk about. We really wanted to fill the gap. So we wanted to do our distributions where and when other distributions weren't occurring. We were trying to get the food as close to the people in need as possible. However, we had a challenge in determining where were all the distributions happening and when. We had a great, and we continue to have a great partnership with the Clark County School District, where we're at several middle and elementary schools. So when the families pull up to pick up their child's meal, they just pull down a little bit further and they can pick up food for the entire family. We also were in several low-income housing residences as well as Columbia Brookside, which is for older adults and families. We really put a lot of thought into the type of food we were going to distribute for Athens Eats. We wanted to make sure that we were distributing complete meals. So if the family had access to no other food, what we gave them within Athens Eats would provide a full meal. So the commodity bags were each 10 meals. It may be peanut butter and jelly sandwich. It may have been chicken salad sandwiches, all the ingredients you need for that. Could be soup, pasta. We also distributed fresh produce in partnership with the farmers market and collective harvest. And then we had a partnership with Georgia Grown so that we could do produce boxes mixed in with protein. And then we distributed milk and bread and things like that as well. We also had, through a partnership with Epting Events, we had frozen prepared meals, which the prepared meals were really critical for families who weren't able to prepare the meals, having that option. We got excellent feedback on those. And then we really wanted to make sure that we were meeting the specific needs as much as possible of the people who were being served. And we wanted to give them choice as much as possible. So having the option to fund Athens Farmers Market voucher, was really important to us. What we've heard for years from seniors and also the families of those we serve is that the farmers market felt like it wasn't accessible. So having the opportunity to use those vouchers, it really gave I think more people realized how accessible the market can be. We got probably some of the best feedback about people who have never been to the farmers market before being able to utilize these vouchers. And then we also designed and built a database that allowed us to collect all of our demographic, income, service data. And then we did a survey with our enrollees so that we could collect evaluation data. So looking at our numbers, Athens Eats Together was a successful initiative. We provided 262,000 meals to 8,100 Athens Clark County residents. 39% of those were under the age of 18, 30% were over the age of 60. We served 2,000, almost 2,500 households total. Towards the end of the original project, the original contract in January, we were hitting record numbers. The last 2 weeks of January, we were serving about 2,600 people, 17,000 meals a week. We had 20 different distribution sites throughout the community, and I'll kind of show you where those are very quickly, averaging about 10 food distributions a week. We had 75 delivery routes. We were able to recruit 168 volunteers to help out with these community routes. We did bulk delivery. So again, the goal was to get the food as far as we could, as close as we could to the people who needed it. So we did bulk distributions in several neighborhoods. We also partnered with several nonprofits, Athens Nurses Clinic, We partnered with Advantage Behavioral, the Shifa Clinic, a couple of others as well to do bulk off distributions. The neighborhood leaders were critical to our efforts. They delivered to 178 households in each of their neighborhood zones, averaging about 15 hours of volunteer service for Athens Eats Together. Not only were they critical in getting the food, but they were also critical in getting the word out that the food was available. We also had neighborhood leaders who helped us with our weekend distributions as well. And then I think, again, the purpose of the contract for Athens Eats Together was to provide food to residents of Athens, Clarke County. A secondary benefit of this program was that ACCA and Epting Events, both of our businesses, for ACCA at a time where the demand has never been higher for our services, we shut down almost our entire nonprofit. So our revenue tanked, but our need, as I said, was 4,000% more than what it was prior to. Athens Eats Together was an opportunity for us to make sure that we retained employment for all of our workforce. So our CNAs who typically work in our adult day health program that's now closed are packing food, delivering food, working food distributions, making sure that it's foods to the people. Epting Events was the same way. The priority for Epting was to get the food to the folks, but also so that Epting could maintain employment for theirs. So in total, 55 direct workforce staff maintained their employment through Athens Eats Together. We were also able to hire one new position, which I'm happy to report ACCA is going to be able to keep that person on our payroll even after the contract. So this is just a really quick map of the people that we served. The larger purple icons are our distribution sites. Each dot doesn't necessarily represent one household. Sometimes it represents a cluster of household if it's an apartment complex or someplace that we have a lot of people. You'll see that some of the more sparse dots are going to be where it's more, the population is more dense. The delivery dots are green and the purple were where we did a distribution. So what are our lessons learned? Our partnerships, we have learned that partnerships are critical. We're called the Athens Community Council on Aging for a reason, and it's because we've always had the community involved with our work. And during COVID, it was no better time to truly use those partnerships. So when we were approached and asked, use your best resources to get this done, for us, some of those existing partnerships were our best resources. Reaching out to the Food Bank of Northeast Georgia, who we knew had access to the food we need at an affordable cost, and who we knew we could also scale up very quickly alongside of us. Epting Events, not only did we need access to the frozen meals that Epting could do, if you look at the pictures below, you'll see this was us down trying to unload food from a van at the beginning of the project. This is a wheelchair lift where we're typically transporting our clients back and forth to our center. Here, we're transporting produce to a school distribution. The next picture is when Epting came along and we were able to utilize all of their logistical, their warehouse, their storage, their freezer, their trucks, everything else. We're part of this partnership that we did not have by ourselves. Utilizing the Athens Farmers Market, I'm just amazed at what they did. Prior to Athens Eats, they did vouchers for about $500 a week. They were able to scale up very, very quickly in a matter of 16 weeks from 500 to their busiest market with vouchers was $15,000 in one market. And they were able to scale up with all the resources behind that as far as the experienced staff and have the vendors available for that. Another critical place where partnerships were important was to build the trust that ACCA didn't have time to do. We all know partnerships are established through trust. By partnering with the Clarke County School District, we were able to 20% of the people served with Athens Eats Together as part of the Latinx community. Our partnership with the school district allowed us to access a lot of those families that we probably would not have been able to. We had that centralized referral and intake, which we heard from other nonprofits. We heard from enrollees how critical that was to call one number, give one information, and find out exactly where to get food immediately. 52% of our food that we distributed was delivered. And that's a huge stat to consider. When we look at traditionally, most food offerings are done through drive-through distributions. For the purpose of this project, 52% was delivered. And switching over to our survey data on the right-hand column, 74% of people who received food from Athens Eats reported that they had received it for the very first time. And I think that tells us a couple of things. I think it says that COVID created a need that wasn't there in the past. But when I look at that, I also say the program was designed so more people could access the food. And that was done through that centralized phone lines intake process, but then also because we had the delivery option. Access to reliable, affordable, and accessible transportation is a large barrier to food relief efforts. And we certainly saw this through Athens Eats together. If you look at, we ask how many people food need is going to be COVID related, so temporary need, or if it's going to be an ongoing need. 66% of the families said that their food need is ongoing. Those who have an ongoing need for food tend to receive their food weekly and tend to have it delivered to their home. So we know that the need for delivery and the need for food is going to continue. There's a large need for food relief in adjacent counties, and I bet you all of you all see that too from most of our distributions, and especially our Saturday distributions. We had a lot of people from outside the county who were accessing our food. We were fortunate, we had a large grant from Meals on Wheels America, so we were able to fund some of these folks from out of the county, so they did receive the service. But I do know that, you know, as food relief providers, that often we're asked to go outside as often what is the scope of existing contracts. The other thing that came up quite a bit is a lot of folks not only ask us for food relief, but they ask for help with things like household items. They ask for toilet paper, sanitizers, things like that, that were not a part of this contract. So we were able to provide minimum amounts of this because we were able to ask donors, and we had other partners who reached out and asked what we need, and this is what we said. But I'm quite certain that in your programs, you also have this challenge as well. And then we were distributing a lot of food. Like I said, it was 17,000 meals. I believe it was over 248 tons. Leslie would probably know those numbers. But chasing those food supplies during a pandemic was very challenging. Having access to large food vendors because of our association with Meals on Wheels America, we were able to go into a large buying group with US Foods, so we got discount on some of those foods. Being able to buy large scale through the Food Bank of Northeast Georgia, and then having access to Epting events, again, was and Georgia grown, having the full state resources for some of those products was incredibly critical for this program. When we look at ongoing needs, low wages was the number one reason why people needed food with Athens Eats. And I think that's it for the survey data. So what's next? So we're looking at, so this slide really should say recommendations and what's next. So when we as ACCA, when we look at our food relief efforts during the rest of however long this pandemic goes out, as well as after, the critical things that we have learned and that we recommend for large scale food distributions is easy access, you know, a very quick way to find out about the program, enroll in the program. What we know, and from talking to a lot of enrollees and from our experience through this, is that currently without Athens Eats, it's a very complex and can be a challenging system to try to determine where is the food distribution, when is the food distribution, am I eligible for the food distribution, and finally, how do I get to that food distribution? Having those accessible options are critical. One story that we heard that I've been telling is we had a single mother who said having the delivery was so important to her. She typically utilizes public transportation, and getting a food distribution with a heavy bag, extra produce, and then having her young children on the bus with her was nearly impossible. So having the option of having that food delivered allowed her to get more in one distribution. Having those complete meals, I think it makes sure that we're getting accessible and appropriate food to the people who are food insecure. It also offers that layer of dignity to make sure that people know that there's intent and design in creating not only foods that sustain you, but foods that taste good. And then making sure that we're always evaluating our service. Where's our service happening? How's our service happening? Where do we still see the needs? Where are the gaps in the needs? And then that evaluation data. So what's next for this project? Like I said, Athens Eats Together will extend through April. At the very beginning of Athens Eats, in our initial conversations, Stephen and I, and certainly Haley and Crystal, it was never the intent to spend the entire budget for this program. And I think that's really important. We put a lot of energy into being efficient and to have cost savings, because our hope through this partnership is we would provide this meal service to as many people as needed us. And then from the other end is we would take all of this data and then we would say, these are where the existing gaps are that we know about because of this investment, this large investment in this project. We're going to look at this data, and then the remainder of the funds are going to go towards some sort of initial sustainable initiative to fight food insecurity in Athens. So the good news is that using some of the information we know, there are a couple of projects that will come from Athens Eats Together. And then I hope that this is a perfect opportunity right now for us to look at all of the different services, excellent services that we provide in a community. And is there a way for us to collaborate and work together? Because we know we can serve more with less if we're doing it as a group. When we initially started Athens Eats Together, our hope was to partner with a lot of different organizations, not just those on this call. And for many reasons, a lot of those partnerships didn't occur. I think there were barriers and challenges. So at ACCA, our hope is that we can have open discussions about how we can continue this effort moving forward, and would love to talk to anyone about doing that. But in the meantime, Erin, if it's okay, it'd be great if Meg could talk about the Athens Wellbeing Project and how they've begun to look at some of this data for their work, and then putting Josh on the spot, maybe just a couple minutes. And then if Stephen has anything to add to it, because again, I cannot overemphasize how incredibly grateful we are to Stephen. He's put so much time and energy and just real passion behind this work. And he and I have never met in person, but he's one of my top 3 favorite people in the world right now. So thank you, Stephen, Haley, and Crystal. So if he has anything to add as well. And if there's
So
any
I think
questions.
we're going next to
I know that was
Meg. Then. Yeah. Thanks, Meg. Thank you, Eve. And I can confirm that Stephen is just as good or better in person than he is virtually. He's super solid. Thanks, Stephen. Thanks, Eve. And Leslie.
All right. For those of you who I've not met before, I'm Meg Bramlett. I am a doctoral fellow for the Athens Wellbeing Project. I've worked with AWP for a little over 3 years now, and I'm sort of serving as the community representative while Grace is on family leave. So Eve was kind enough to share with us the Athens Eats Together data, and we were able to look at how some of what the findings showed were reinforcing each other between AWP data and the Athens Eats data. And then we also looked at just a couple of things that were peripherally related that can help really give a better idea of what the landscape is. Shout out always to our institutional partners. Thank you, Envision Athens, for having us. Without all of these organizations, none of this would be possible, and we're always so grateful for the support. And I always want to give context where possible. So the threshold for SNAP eligibility is 130% the federal poverty level. And it's a common cutoff for several benefits. And I just think it's important for us to see exactly what those numbers look like. So that's based on your household size. Typically, if you're 130 or less, you're eligible for benefits. If you're over, you're most likely not eligible for benefits. And here's the, we've got the annual and monthly here. Okay. So here, this is directly from the Athens Wellbeing Project. And just again, as a caveat, sorry, I always give so many notes of context, but I just feel like it's so important. These data were collected in 2018, so pre-pandemic. It is a random sample and we are able to use sample weight, so it's considered representative of the community. So we asked in the past 12 months, how often were you unable to afford to eat balanced meals? 55% of households who are below that threshold, the 130, said sometimes or often this was true. And 21% of households that were ineligible or above the 130 marker responded that this was also the case. So I think there are a couple important points here. One, that it's double for those who are below the 130 marker, but also that about 1 in 5 who don't qualify said that this was an issue sometimes or often. So that's something to keep in mind. You know, as we're looking at this, it's a lot of people have issues for a number of reasons affording balanced meals. Okay, and here's a way that we were able to kind of layer the data. So AWP asked, are you currently receiving SNAP benefits? 55% of eligible households, those whose household income was at or below the threshold, were not receiving SNAP benefits. 62% of Athens Eats households were not currently receiving benefits. I wasn't able to cut that off at the household income level, which might account for why it's a little bit higher. But this, either way you look at it, is pretty significant. So more than half of people who might be or likely are eligible for benefits are not receiving benefits. Athens Eats on their survey asked, if you're not receiving benefits, why not? And one really interesting finding was that about 1 in 4 said it was because they weren't sure they were eligible. So we always like to look for the low-hanging fruit. What are some opportunities for action? And this really stood out here. It wasn't because it wasn't convenient. Some people said that the benefits weren't really worth it. But this was a huge, huge group. 26% said they just didn't know if they were eligible. And then we were able to kind of look at need and benefits layered together. So as Eve mentioned, 66% of households reported that they had an ongoing need. So those that Athens Eats served, it wasn't a temporary need. It wasn't necessarily, it might have been made worse by the pandemic, but it's not a pandemic specific need. And 58% of those with ongoing need are not receiving benefits. And this is an example, again, of sort of a peripheral point that I think is really important to look at. So the Census Bureau has sort of this housing burden standard, where if 30% or more of your income is spent on housing, you're considered housing burdened. So that's just a little bit of context. And you can see here, when we look at the AWP data, we look at the amount people are paying for their housing as compared to their income. Over half of houses that are at or below the SNAP threshold are housing burdened. 54% are spending more than 30% of their income on housing, and 14% who are above the 130 threshold, which is significantly less. However, it's still a lot. That's still about 15%. So it's just another way that you know, this is important when people say that they can't afford food. It can be for a number of reasons. And when your housing is taking a lot of your paycheck, it takes away from every other bucket that you're able to use. So, and that's kind of it. We pulled a couple of points here and just wanted to share them. I did want to just mention that we're going to start collecting our third round of data, hopefully at the end of this year. And community support is huge and getting the word out. So we're just trying to kind of put it on people's radar. We're going to start asking you to get the word out that the survey is happening. So I feel really lucky that we were able to partner with Athens Eats in this sort of mini data analysis. And this is something that we really like to do. This is something that's really important to us. So again, thanks everyone who supports AWP in an ongoing way.
Oh, I think Erin might have gotten booted and rejoined again. Erin, did you just join again? I think she is rejoining. Meg, thanks so much for sharing, and Eve confirmed with me that we could share the presentation with the group. Meg, is it all right to share the presentation and follow up with the group afterwards as well?
Yeah, absolutely.
Awesome. And I saw Stephen. Stephen, would you like to add anything about Athens Eats Together?
Sure, just briefly before I jump off to the next call. First, I just wanted to say how much I've appreciated being part of this. My day job is working in public works, which has nothing to do with this, except for the ability to do, program or project management. At least Crystal works in, inclusion and equity, and Haley works in HCD. So they have much stronger ties to this, but it's been a great eye-opening experience getting to work with these fine partners in our community. So I appreciate, being able to jump into that. I think, my only thing to point out today, I think Erin's going to bring up about the remaining funds, resiliency funds that are out there, and the ability for you all to jump in and capture some of that with the upcoming RFP for food and indigent services. So I'll let her speak more to that, and then looking forward to hearing a little bit from Josh if he's available to talk a little bit more about the GivePulse platform and data information hub that is being started over there as well. So thanks again, y'all.
Great. Stephen, thank you. And guys, I'll talk while I have the opportunity because I keep getting the boot for my internet issues here. So I did drop the link in the chat box to the RFP. So as Stephen mentioned, there are some funds remaining specifically for the purpose of food, housing, and homeless services assistance. And I think the key note for that application process is that the deadline is March 19th, which is a week from this Friday. So if there's any interest in applying for those funds, that needs to move from plan to proposal as soon as possible. I know that, something that has been mentioned on this call through the collaboration of AET and all of the things that it secured and, was successful in, the increase of access to fresh food is key. And so I know that the farmers market and West Broad are on the call today. This could be an opportunity for those groups to work together to maybe increase some fresh food access in the coming days. I know that we wanted to hear from Josh Podvin. There's actually a lot to talk about and only limited time remaining. So before the meeting closes, just to get a sense of what all I would love for us to be able to cover is kind of talk through some of the SNAP outreach efforts that are upcoming and in progress, hear from Josh Podvin about GivePulse, and then just kind of take a bird's eye view of, as Athens Eats Together comes to a close at the end of April, what needs do we anticipate and what are some collaborative opportunities to help address those needs? So Josh, let's go to you next if you're comfortable.
Sure, that's great. And I'll share my screen in a second. I know y'all have heard various iterations of how we came to be at this space, but just to recap for those that are maybe new, I work with community partnerships at UGA, and I help manage a platform called Give Pulse, or at UGA we brand it as Engage Georgia. It's traditionally a volunteer management platform, but what it really serves as a hub, so you can collect a lot of information on it about upcoming opportunities. And as the issues around food insecurity continued to come to light during the pandemic, we thought that it would be a great space to be able to provide some real-time information about food distributions happening in our community. So we talked about how we might be able to facilitate that. So what we've been doing John, can you share screen sharing with me, or Aaron, one of the two?
Josh, are you trying to share the community food resources on Give Pulse?
Yep. Yeah, or you can, by all means, you can share it. So, what we've been doing is we've been, well, and thanks to this group last call, I know many of you, Dr. Shannon and others, have sent lists our way. And so our process is a little different. Instead of being a point in time snapshot of distributions, what we're trying to do is have an ongoing dialogue to verify the details associated with the distribution. We've seen many instances where something that has been going on for a long time, maybe an organization has served breakfast, they'll stop serving breakfast, and the last thing we want to do is send a community member or have a client refer somebody to a distribution that's not happening anymore. So we're in ongoing communication with different agencies that are doing this, trying to confirm details and then post those quickly to the site. So we're trying also, in addition to distributions, to document food pantries, community fridges, different things that exist out there. So like I said, this space can be a hub. So we have the ability also to share about upcoming programs or opportunities. So if you have information, again, we're just taking it all in and sharing that there. And then what this is a real-time distribution list or calendar. So if you want to look at, like, on Thursday, Covenant Presbyterian, I know a lot of folks know about that, from 1 to 4. If John clicks on that, a little window pops up and it will share information about the distribution, the type of meals served, or provisions provided, if there are any restrictions or requirements related to that distribution. And then there's some general COVID details that get connected to pretty much every event on Give Pulse right now. Additionally, and one of the things that we can do is change the view. So John, if you go up and there's a little globe on the right-hand side there, we can start to see the landscape of the distributions that are happening in our community. But we're also fortunate to work at a university where we have some fantastic faculty. And after the last call, Dr. Hilda Kurtz reached out. She has 2 different student groups that are going to work on taking the data that we're collecting, and they're also working with Eve and the Athens Eats Together initiative, and starting to really look at how we can layer this data to be able to make more informed decisions about where distribution should be occurring in the community, that we can understand where there may be public and private distributions, where there are bus routes in conjunction with these distributions, so we can tell a richer story about the food landscape in our community. So that's a real quick view. We are confirming some details right now. So I imagine that there's probably about 12 to 15 agencies represented on the page right now. But there's a list of over 75 or so that we're confirming details with. And that's probably the hardest part of this, is the ongoing tracking down of agencies and ensuring that they're still distributing in the way that that we've seen. It's been very disparate over time, and the information changes. So you should see the number of distributions grow exponentially over the coming weeks as we check in with folks and verify those details.
Josh, thank you. And I'm guessing it goes without saying, but in the development of this, I'm sure that you are very connected to Mark and 211 and that they kind of have a higher level view. And then this really digs into like that granular level on this day at this time. And then is the food bank? Yes, I see Sherry and Mr. Boone. Is there an ongoing connectivity between this platform and food bank so that if a food pantry changes their days and times, I'm just curious, is there a mechanism for that?
So we do have all of our mobile pantries listed on our website, and we do go in and update those when we find out they're going to be canceled. We also put it on our social media to try to get the word out to as many people as possible. A lot of times these cancellations come very last minute, especially in the time of COVID. If there's an outbreak or volunteers are unable to serve, they do get canceled.
Totally understood. Yeah, Josh, thank you so much.
Yeah.
You're
Just so
such
you
a great
know,
collaborator.
We are pulling from that food bank list, and I reached out the other week, and just, with everybody extremely busy trying to put our heads together on how we can shorten that communication length so that we're putting the most real-time information out there.
You can. You want to bring it up?
Thanks, Josh. And while we're in conversation with the food bank, I just want to note that, the conversation today is pretty focused on some extra heavy lifting for this past year. And the food bank definitely did their share of that as well. And, a lot of the folks that are gathered around this virtual table are people that have been engaged in food insecurity and supporting people for many, many years. And a lot of you represent those organizations. So I just want to acknowledge the great history that kind of backs this conversation. Food Bank, just if you have anything to share with us, any needs that this collaborative group can help support or anything that's on the horizon for you, just want to give you all a second to chime in.
Well, Erin, one thing we have going right now, we have this farm to food project that's shipping in here. We got 1,100 cases last week. We got another 1,100 cases coming in tomorrow. So all of our food pantry has a lot of fresh. It comes in, it's got produce, it's got meat, it's got milk, cheese, and everything in this. It's a good box, and it's going out to every mobile pantry we got. We'll be set up tomorrow afternoon on the parking lot behind the Circle K off for Chase Street. So looks like we got a lot of these boxes coming in. I know there's one going to the Lions Club out in Watkinsville. They asked for some support from us because I think that what you need to be careful about these, you have to have refrigeration or you cannot handle this. So I see David on there. He understands that without refrigeration, you don't need to be handling perishables, that's for sure. But that's one of the projects we're pushing right now. We are in good shape as far as our normal food supply through USDA. So we can do a pretty good job of supporting anyone that needs food.
Great. Thanks to you both. And then I see Sherry Anderson, the other Sherry Anderson. Are you with us?
Yep, that's me. Is
there
that
you
me?
Go. Hey, Sherry. Believe it or not, this group hosts two people by the name of Sherry Anderson.
Hey,
so you can imagine that led to serious confusion around which email address. Yeah, it was very special. So the other Sherry Anderson representing our partnership and the great work in Winterville, I think you have an announcement to share with us.
Well, we are excited. We applied to become a food oasis with Georgia Organics and the Food Oasis Network, and applied for a grant through them, and we were granted the grant. So it's exciting. They had 20 different organizations apply, and we were one of 8 that received the full amount that we asked for. So that was very exciting for us, considering, we're at the grassroots level. So yeah.
That's amazing. And what will that mean for your work? Like practically, what will that provide you?
Mm-hmm. So we're basically using the funds to help us get some supplies for the market for COVID precautions, signage, some tents and tables and weights, and then some advertising. And we want to collaborate with other local organizations who accept SNAP benefits to do a collective advertising effort. And so we'll use some of those funds for that advertising effort as well.
Fantastic. Congratulations.
Yes. And then, yeah, then just basic supplies and stuff to get us going. So, and then we also have met with a bee farmers association and looking to get the pavilion approved to be a honey house and get the supplies that they need for that to become a honey house. And it'll be movable so that when we get our commercial kitchen set up, that will go with us into our commercial kitchen, but that'll help create some momentum with that. And the other exciting news is we've gotten approved to renovate the pit that's there where we had our drop-offs last season. We're going to enclose it, and part of it, like a 12 foot by 12 foot square, I think it is going to be cold storage. And we're going to have a couple of deep freezers. And then we're also discussing making that our phase 1 small commercial kitchen.
Fantastic. Congratulations on that. Marigold Market really took off, believe it or not, in a COVID year. I'm not really sure how you all did it, but I'm grateful that you did. While we're on the topic, we're going to start winding down to the 2 p.m. Endpoint. But would love to just note that a lot of our markets are coming back in person at some point. So Athens Farmers Market kicked off its market this past Saturday, and I was happy to be there and support that. It went incredibly well, many new vendors. Sherry, do you have a date set for Marigold?
For the start date?
Yes.
Yes, we are intending to start our in-person May 1st, 10
May
to 2.
1st? Okay. Great. And then West Broad, I'm not sure if Ellie is still with us, or Cameron. Do you all have a date?
We don't. We're still, we're hoping, we keep saying maybe May, I don't know. Yeah. But we are online, and, we've been using that platform with success. So we are able to get, provide fresh produce locally for that. But still to be determined when we'll have our in-person.
Understand. Well, let us know, and we're happy to get the word out. Yeah, we're blessed to have a few markets, and I think there is the need for a few. So that's great. I'm going to drop the link one last time, just as we start to wind down. I know we have a couple of other announcements, but again, if you joined the call a little bit late, the RFP has been released for government funding to support food, housing, homeless services. The deadline for that is March 19th. SNAP outreach has been mentioned a few times, and those of you who have been around the Abundance Athens block for a while know that that is a huge cornerstone of our work, because we have a $20.5 million gap between eligible and enrolled people. So just a few things that are going on in that arena. Terrace, thank you for your leadership in this. Terrace and I work together to connect to the state DFACS office and look at the potential for Family Connection and the Neighborhood Leaders Program to be an official SNAP outreach partner. So we hope to be in touch in the future with an update there. Also, with the support of Terrace and John Morris and Meg Bramlett on this call, we are pursuing funding from the Robert Wood Johnson Foundation to support that partnership and SNAP outreach. And then John or Meg, if you have a quick update for us regarding the work with the NMI student group on clarifying the SNAP process, would love to hear from you guys.
Yeah, I can speak to that. Well, first of all, in partnership with Athens Eats Together, we're working on developing just a general food resources flyer to include in food boxes and distributions that are going out. So that's just a general information flyer that connects with some basic information regarding SNAP and food resources that will go directly into the hands of people that are getting Athens Eats Together boxes. So we're working on building that flyer this week and getting it out as soon as possible. And the New Media Institute students are digging deep into the SNAP process, and we've had a couple focus group meetings with neighborhood leaders. Thanks for the partnership and collaboration there from Terrace and a couple neighborhood leaders. I know Patrick has been one that's joined those conversations a lot. And they're looking to honestly do something similar to kind of what Josh Podvin shared on the GivePulse platform, develop but more in terms of SNAP enrollment, a general information website page that kind of highlights and walks people through the SNAP enrollment process, so that even if people that are trying to enroll aren't using that, the neighborhood leaders have a digital tool that they can use as kind of their walkthrough for the SNAP enrollment process. So the end goal of that is basically kind of targeting what Meg shared about people that aren't sure if they're eligible, that aren't sure what documents they need, to kind of have a one-stop shop for SNAP enrollment and connect to other resources like the GivePulse that Josh shared as well. So that was a lot, but that's kind of what we have going on in our group just for SNAP outreach, is to develop the resources so that people that want to get enrolled in SNAP have a little straightforward checklist type of process to doing it. And people that want to help family members, friends, or other residents in their neighborhood get enrolled, they also can view that site or with step-by-step instructions and potentially even videos that walk through how to do it all.
Thanks, guys. And do you think you'll have a sample or a beta test for us to review next month? Is that the goal?
They actually just sent the first version of the flyer. So the flyer should be, we really kind of run as quickly as we can on that. So that should be out very soon. And it sounds like the website, should be up and running by the end of the month.
And am I correct in saying that the conversation has already occurred regarding getting these into the food provision with Athens Eats Together?
Yes. Yep.
Okay.
We've talked with Eve about that. That's in process. We are also working on getting it translated into Spanish.
Fantastic. So I'm just curious, while we're here, and I hope this is worth it to you guys to maybe stay just 2 more minutes outside of 2 o'clock. Are there other recipients of food who are not included in the Athens Eats Together group who might also be eligible for SNAP and not enrolled? So I'm just wondering, the other Sherry Anderson and Mr. Boone, would you all be willing to include this with some of your outreach?
What do you think? Yes, I mean, we're happy to share any information. So whatever we can do, we're always happy to do it.
And then I don't know to what extent it is as likely that folks who are maybe utilizing the different markets that we've discussed could also be in that category. But I do think if we have the tool available, why not try to disseminate it as widely and comprehensively as possible? If, out of 100 people, 5 are eligible and not enrolled, that's a life-changing benefit. So
exactly.
Fantastic. Okay.
And I'll say too, I know this is a very targeted group. We're also looking at maybe some groups who would be peripherally good outlets for this information. So like the Athens area diaper bank, I think is going to be distributing. So I put my email in the chat. I'll put it again, but if anybody wants to receive anything specifically or has anyone not in this group who you could link with us, that would be fantastic. I think the more the better.
So if we can just do this, Meg, once it is finalized, I think you guys said you might want it to be reviewed by a few different folks just to ensure it's totally final. When that is complete, I'm happy for us to share this with the entire Abundance group, just so everybody in this conversation and those who couldn't join today will have that within the next couple of days, if that works for everyone. Fantastic. Okay. And then as we move toward closing out, I think we have an announcement / maybe opportunity from Jamie, Dr. Moore. So would love to hear from you.
Hi, so I'm here in Tim's place today because he double booked. We are applying for a grant with the Department of Early Care and Learning. That's the early childhood arm of the Department of Education. They have grants for supporting food insecurity, supporting food assistance for children birth to 5. And our plan is to address the under enrollment in SNAP and WIC, as well as CACFP, which is the child and adult care of food program for childcare centers. So our plan is to, well, first of all, Daniel Epting has a bus, and we're going to wrap it to make it really official, improve some confidence, develop some consumer confidence in signing up for SNAP and WIC at mobile units around the community. And we're also, oh, he's showing you the bus right now and how he's peeling off the stickers. Today, they're peeling off the stickers. But a big part of this grant would be about developing MOUs between different organizations so that we can streamline processes and identify barriers to improve equitable access to SNAP and WIC. I heard the people at the ACCA talking about the diverse needs of people in terms of accessibility, and that's something we want to lift up more. We're also interested in evaluating some of the community use data on WIC and SNAP for the last 5 years, so we can report how systemic changes in putting like WIC online and doing some different things that they've done in terms of access has changed accessibility, and then also to be able to describe what the impact of COVID has had on use of those services. Am I missing anything about our project? Oh, we're also talking to grocery stores. We'll be holding community meetings with grocery store owners to talk about some of the barriers to effective SNAP use at their businesses. And we're also holding some focus groups with community members about barriers so that we can identify the multiple issues that may be creating barriers. And we're looking for partners. This is a collaborative effort. The most sustainable impact of this, we think, will be the memorandums of understanding between agencies, specifically WIC and Department of Health and possibly childcare centers, because the underutilization of WIC is just, so it's even more than SNAP. So if anyone is interested in partnering with us, please let me know. I'm sure many of the people on this call are already our partners. We are using a lot of the Athens Wellbeing Project data to make the case for this project, and it will be an 18-month project.
And just to clarify, is the support for increasing SNAP or WIC or both?
Both.
Okay, just wanted to clarify that.
Because it's for families of children birth to 5, the idea is to, gotcha. So there's been so much focus on SNAP, we want to also lift up WIC. And yeah.
Absolutely.
And CACFP, which is lesser known, but that's for businesses like childcare providers and senior centers that receive the federal stipends for providing food in care situations.
Great. Thanks so much. So Jamie, Dr. Moore, you, Tim, if there's any other connection you would like from this group or any specific support, just let us know, and I'm happy to facilitate that.
Wonderful. Where can I find a list of everyone all the organizations that are in this partnership?
The distribution list is actually open for that purpose. So whenever you're, you'll be added to this distribution list, and we leave that open so that you can find one another and reach out directly. So yeah, happy to facilitate that. So guys, we're a few minutes over, but that's because we had a lot of good things to share today. Even Meg, thank you for your presentation, and thanks for all the partnership and just I keep saying heavy lifting because it's true, like literally and figuratively. Thank you so much. And Daniel, we haven't heard from you much today, but just want to note that you find a way to make all sorts of things happen. I'm really not sure how, but we also couldn't do it without you. So appreciate you.
Go team.
And as always, the neighborhood leaders are on the move. As we close the call, I just want to suggest that I would love to see a neighborhood leader like carpool karaoke at some point. I think that would be amazing because y'all are always like, you have your steering wheel. I love it. I mean, I will be there for it. Terrace, if you want to make it happen, I'm there for it. All right.
All right. You said it.
I know you're there for it too. We are so much overtime. Let's work together outside of the space to schedule the next meeting, but we will definitely come back together in the next month. I look forward to it and thank you.